My name is Pat Iyer. I'm a legal nurse consultant who has helped attorneys with over 100 emergency department medical or nursing malpractice cases. The emergency department is one of the highest risk areas of the hospital. In this video, I share tips on the risks of performing the initial assessment of emergency department patients, a process called triage. Here's the first risk. Many facilities use assessment protocols to guide the triage nurse in asking questions related to common complaints that would bring a patient to the ED. But here is a risk. A focused assessment may result in the risk of missing other significant medical conditions that warrant immediate care. There are several life-threatening conditions that affect patients. These are easily organized into 4 letters, A, B, C, D. Checking the ABCDs is done rapidly. A stands for airway. The triage nurse assesses whether the airway is clear from the mouth to the lungs. B stands for breathing. Nurses assess whether the patient is breathing. C stands for circulation. If a pulse cannot be found, there is no blood circulating. Emergency personnel may start rhythmic chest compressions. C also means to check for profuse bleeding, which must be controlled. And D stands for disability. It involves checking for injuries or symptoms. A patient can die if there's a delay in recognizing that she has a blockage in her airway, is not breathing, has no pulse, or has a serious injury or medical condition. The first risk is not recognizing a life-threatening condition. The second risk is not notifying the emergency department physician about a life-threatening condition. The triage nurse must notify the ED attending physician of concerns regarding patients who appear to be very ill. The triage nurse's duty is to recognize who needs to have further evaluation or immediate treatment. The nurse's fundamental responsibility is to act as an advocate for the patient to gain the attention of the physician, who can then order diagnostic tests and treatment. I discussed the liability issues associated with emergency department care in my new book, Analyzing Emergency Department Medical Malpractice Cases. I wrote this book to assist legal nurse consultants and attorneys who handle emergency department medical malpractice cases. Get ordering information at the link below.